after injury. What is the definition of tissue repair?
Mission?
Tissue repair.
Definition.
Okay, definition of tissue repair. It's healing, okay? Healing after injury. When we discussed about tissue repair, we discussed about healing after an injury. Okay? But it's dependent to many factors. So, the aim of healing is restoration of tissue for normal function, normal shape, and normal architecture. And it is critical for all of organisms, such as human, to restore the injured tissue to normal function and normal architecture. Because we have many damage daily in environment, in internal organ and external organ. So we need regeneration and healing. We have two types of reaction or healing after damage. We have regeneration, we have scar. Okay, regeneration is very good if we have ability to regeneration. Regeneration is a replacement of tissue and injured tissue with normal tissue. For example, we have loss of skin after incision and replaced by normal skin. It's called regeneration. But in scar, when we don't have ability to regeneration, scar is out there. In the most situation, in healing, we have regeneration and both scar, okay? But when we have regeneration, when regeneration is dominant, the result is better rather than scar. So this figure shows regeneration rather than scar tissue. When have superficial or mild injury, for example, also, for example, only epithelial damage. When we have only epithelial damage, we have regeneration because we have some stem cell regenerated, again epithelium regenerated, again skin, and we have normal replacement of regenerated cell similar to the normal tissue in function and in shape. But after severe injury, damage to basement membrane, damage to stem cell for proliferation, the tissue is healed, but architecture is not normal. Function is not fully normal, but tissue is repaired. For regeneration, we need some cell with proliferative activity, rapidly dividing, for example, epithelium, and also need to tissue stem cell. Tissue stem cells are necessary for regeneration because we need to the cell for capability of dividing for replacement of normal tissue. Also, in proliferation cell, we have need to stem cell for cell proliferation. We look to some growth factor for activating this stem cell, and also we need to normal extracellular matrix with normal integrity for response to regeneration. Also, we need to vascular endothelial cell and fibroblasts. These elements are necessary for excuse me. These elements are necessary for cell regeneration. Also, several cells are critical for regeneration and signal transduction. For regeneration, we need to remnant of injured cell. vascular endothelial cell, and also we need two fibroblasts. But we have three types of cells. Some cells have ability to proliferate continuously. This is called labial tissue. For example, hematopoietic cell in the bone marrow continuously proliferate blood element, continuously produce RBC, white BC, and platelet without any limitation. Okay? Or epithelial lining, for example, skin. For example, epithelial lining of respiratory tract, epithelial lining of GI tract, urinary tract, damaged continuously and replaced by stem cell continuously. They are a continuously dividing tissue, and the tissue is labial tissue. This tissue has full of stem cell for proliferation and need normal stem cell for proliferation. Also, we have a stable tissue. A stable tissue are quiescent cell. The stable tissue in the cell sheet are in the G-cell stage. They don't proliferate continuously and spontaneously. They proliferated after injury, if necessary. For example, parenchyma of most solid organ. For example, liver. When we have a damage in liver after surgery, when the surgeon remove a part of liver, quiescent cell activated and regenerated the remnant of liver. Also, endothelial cell, fibroblast, and smooth cell. Also in solid organs such as kidney and pancreas. This cell is important in wound healing. Exception of liver has exception of liver has ability to regenerate the liver tissue. Some tissue have limited ability, okay, in a stable tissue. Also, we have permanent tissue, non-proliferative after postnatal. Neuron cell and striated muscle in heart, cardiac muscle are not dividing. After damage, only healing is done by a scar. No generation is occurred. Other striated muscle have limited capacity to proliferation because they have endomysial cell can be divided and produce new cell. So, in permanent tissue, after injury, we only have a scar formation, no generation. With the exception, for example, neuron and cardiac muscle, all of tissue or body have a combination of three cells, labial, stable, and non-dividing. Okay? Also, we need to growth factor. The growth factor has different effects. For example, some of them act on multiple cell level, some of them are cell type specific. And growth factor very, very important to production and initiation of regeneration and healing. But we remember the most source of growth factor are macrophage. Macrophage are the first cell in the inflammation site, okay? Because we have host macrophage and produce growth factor for healing. Also, epithelial cell, stromal cell, and other inflammatory cells produce growth factor. This table shows many growth factors are interfere in the healing. EGF, TGF alpha, HGF, and PDGF, VEGF, PGF2, and FGF2. This source of many of these factors are macrophage and very mitogenic and stimulated mitogen, stimulating dividing, stimulating matrix cell for proliferation.
Do we have to memorize some of these?
It's important.
Is it important? Do we have to memorize?
No. It's not important. Only you remember this name of this growth factor. For example, TGF alpha, PDGF. All of last is growth factor. Last letter is growth factor. In this figure, TGF beta is important. We discuss about later. Okay. And also, we know the most important stem cell is tissue stem cell. For example, when we have injury in the skin, tissue stem cell in the skin is responsible for healing. When we have damage to kidney, we have tissue house stem cell in the liver responsible for replication. And this stem cell has specialized niche. Niche is microenvironment for maintenance of these cells. So, mechanism of tissue regeneration. Mechanisms of tissue regeneration depended to different type of tissue. We discussed above. Severity of injury. Severe injury more associated with scar formation. And for example, in epithelial of intestinal tract, in the skin, injured cell rapidly replaced by normal epithelial cell. And pancreas, adrenal, and other solid organ has limited regenerative capacity. But liver regeneration is an exception because liver has ability to full regeneration of liver in some situation. Regeneration of liver has two major mechanisms: proliferation of remaining hepatocyte and activation of progenitor or stem cell. When we have partial hepatectomy remove of a part of liver by surgery. Okay, we have regeneration of liver, but in this regeneration, when we have loss of 90% of liver, the liver has regenerate again the whole amount of liver. This process is induced by some growth factor. For example, interleukin 6. Interleukin 6 is produced by Kupffer cell. Kupffer cell is house macrophage in the liver, okay, and produce interleukin 6. So I changed the time of this slide by previously so interleukin 6 and hepatic growth factor and many growth factor. What important growth factor of interleukin 6 and hepatic growth factor for regeneration of liver. We discussed about stem cell or progenitor cell and liver. This progenitor cell reside in special niche. In the liver is niche called canal herring, surrounded by tract, extracellular spaces. Okay. Also, when we don't have regeneration ability, the repair is associated with scar. We discussed when we have non-dividing cell, scar is prominent here. Scar is similar to a patch rather than restore the tissue. But we discussed about a step in scar formation. When we have large or severe damage, the first step is hemostatic plaque. When we damage, stop bleeding is the first step. So, aggregation of plaque and attached to injured endothelial cell stop bleeding. So, clot formation with accumulation of many inflammatory cells is first step after few minutes. Okay, stop bleeding and starting of healing. We have aggregation of and migration of inflammatory cell in first 48 years, next 6 to 48 years. M2 macrophage are very important in this process. After 10 days, we have cell proliferation. Cell proliferation occurs from dividing cell, stable cell, and other repair is done by other endothelial cell, fibroblast, and scar tissue. And remodeling of tissue occurs after 2 or 3 weeks after injury. So, when we have a large damage, we recommended to a patient don't tension on ulcer up to 2 or 3 weeks because remodeling is occurring. This figure shows plaque aggregation in first week. You see it?
Yes.
Okay. Plaque will stop bleeding, accumulation of inflammatory cell, macrophage, PN, lymphocyte, and we see plaque in green black. Okay. After the regeneration and scar formation is occur with neoangiogenesis in the ulcer area, granulation tissue is occur, and after a time, regeneration and scar tissue both is occur. Epithelial repellence. Tissue is stable, but deformity in tissue after scar formation is occur. We have 2 types of wound, and healing is different. First, intention healing. When we have killing ulcer, and age of ulcer is clear. For example, after suture or normally, we have cutting with a knife. Okay, without any loss of tissue. But in some situation with second intention healing, for example, in thermal burn, the loss of heavy amount of tissue and edge of ulcer are very far from other. In this situation, we have second intention healing rather than first intention healing. When we have second intention healing, we have more inflammation. In more inflammation, we have large angiogenesis. We have granulation tissue formation. And when we have contraction in the large wound, we have deformity due to contraction of tissue and deformity due to nearing of edge of ulcer to other. So in this patient with profound burning, you see abnormality in the tissue after healing. discuss first intention healing rather than second intention. In first intention, to edge is near. We have clotted blood, accumulation of inflammatory cell, limited angiogenesis. After a 3 or 7 day, replacement of stem cell of epithelial is regenerated, scar regenerated of epithelium, and also healing of matrix is occurred. And after 3 weeks, we have fibrous scar and regeneration of surface epithelium. But in profound and large cell, we have second intention. We have large hemostatic plaque and many inflammatory cells. After 2 or 3 days, inflammatory cell and angiogenesis severe rather than primary intention. And granulation tissue formation is large. So we have regeneration of epithelium and stromal tissue, but deformity is occurred, and also we have a scar in the tissue with depression, with discoloration in the surface of scar tissue. But angiogenesis is very necessary for healing. Angiogenesis or neovascularization is presence of new blood vessel. Okay? New blood vessel formation from existing blood vessel in the primary from venom, in the ulcer area. So angiogenesis is critical process in healing. We don't any healing without angiogenesis. Okay? Angiogenesis have many steps. These steps are very important. We discussed about figure in last slide. The first, we have vasodilation and increased permeability in previous vessel. Previous vessel became dilated due to VEGF, due to nitric oxide, vascular endothelial growth factor, and NO. So, after that, we have separation of crescent from abdominal surface. In this figure, after dilation of quiescent vessel, we have a separation and detachment of crescent. Influence of VEGF. Okay? And we have migration of endothelial cell toward the area of tissue injury. And we have endothelial cell proliferation, remodeling into capillary tube, requirement of periendothelial cell, and suppression of endothelial proliferation and migration. In this figure, we see dilation of venom, pre-site separation or detachment due to VEGF or nitric oxide, and proliferation of endothelial endothelial cell lining internal surface of new blood vessel, and pre-site requirement in the outside or abdominal surface of cell, extracellular material is produced, and new vessel formation we have. Proliferation of this new vessel produce granulation tissue. Growth factors are responsible for angiogenesis is VEGF, vascular endothelial growth factor, FGF, PDGF, and TGF beta. TGF beta is very important. Has very activity with different activity in the tissue. So also we have activation of fibroblasts and deposition of connective tissue when we have a scar. Connective tissue into a step lining healing area, migration and proliferation of fibroblasts, and deposition of extracellular material bus system. In this process, also we have PDGF, FGF, and TGF beta. Major source of this growth factor are macrophage. Also, in healing, we have some special fibroblasts. These fibroblasts called myofibroblasts because have ability to contract and reduce the size of ulcer. In this slide, we see rule of TGF-beta. TGF-beta is most important cytokine for the synthesis and the position of connective tissue protein. TGF-beta stimulated fibroblast migration and proliferation, involved not only in scar, also in development of fibrous. So, TGF-beta overproduction associated with some disease, for example, pulmonary fibrosis, kidney fibrosis, and liver fibrosis in chronic inflammation. Some patients after hepatitis C, hepatitis E, susceptible to hepatic fibrosis and cirrhosis, irreversible function of liver, TGF-beta is responsible. And also, TGF-beta is anti-inflammatory effect. It's opposite function. In TGF-beta, it is C. In this figure, we see a healing. We see epithelium with integrin attached to basement membrane. Also, we have a stroma composed normally from fibroblasts, from blood vessel with normal integrity. Blood vessel have a basement membrane in outer layer. Also, we have extracellular material produced by fibroblasts and other cells in the extracellular matrix. For example, we have fibrillary collagen, we have elastin, protoglycan. It's necessary for integrity of extracellular matrix. And only we have cross-linked collagen and protoglycan. In the basement membrane, we have collagen type 4, we have laminin and protoglycan. All of cell and matrix are responsible in the healing for normal healing of the tissue. In the scar formation, we have a change in the type of collagen. For example, the early healing associated with deposition of collagen 3. After a time, collagen 1 is replaced for collagen 2. Also, we have matrix metalloproteinase. Matrix metalloproteinase are unique enzymes, have some metal in the structure, for example, zinc, Cu. Very important to migration, very important to angiogenesis. In repair and also when we have cancer, matrix metalloproteinase are responsible for extension of tumor and in some situation, the blood extension. In remodeling and in healing, we have some matrix metalloproteinase 1, 2, 3. For example, gelatinase, for example, esteromycins, and the matrix protein 3, 10, or 11 produce invariable amount and responsible for integrity of matrix metalloprotein and healing. But for inhibition of extra production of this protein, we have some tissue inhibitor, matrix metalloprotein, inhibit matrix metalloprotein excess activity. But what we see in morphology after damage to the cell, we have granulation tissue. We discussed about granulation tissue. In granulation tissue, we have prominent neovascularization, presence of many neovascular formation from main venule to better circulation of this wound. So this vascular is very thin and susceptible to rupture. So we have hemorrhage after a minimal trauma. Also, we have exit of water from this vessel. So we have edema. And infiltration of inflammatory cell. So, granulation tissue composed of many new small blood vessels, edema, stroma, and inflammatory cell infiltration. Amount of granulation tissue dependent to size of tissue deficit. When we have large deficit, large granulation tissue is occurring. What is scar? In scar tissue, we have replacement of collagen due to activation of fibroblasts. Collagen is pink in hematoxylin and eosin staining, but for better determination of collagen, we stain with trichrome staining, and collagen became blue. This figure shows many blood vessels in collagenized stroma. Collagenized stroma is blue. But some factors impair tissue repair. Some external and some internal factors. And some situation can be focally and some disease systematically can affect the tissue repair. Infection is one most important cause of delayed healing, but diabetes is important systemic cause of abnormal bone healing. Nutritional essay, for example, deficiency in protein, deficiency in vitamin C. Glucocorticoid consumption has delayed repair of tissue. Mechanical factors such as increased pressure, presence of some suture, such as foreign body, and poor perfusion, for example, in diabetic or neglected tissue, are factors impair tissue repair. We review some ulcer. We have chronic wound due to impaired healing. For example, when we have venous abnormality in return of blood to the cardiac. We have venous leg ulcer. Some patients have chronic venous leg ulcer due to abnormality in the vein in the lower limb. They are susceptible to chronic ulcer and also necrosis due to accumulation of blood in the venous and no normal return. They don't feeding normally and they don't healing acute. Also, when we have defect in arterial circulation, for example, in diabetes, we have end artery obstruction due to diabetes, due to ischemia, when we have diabetic foot with non-treated ulcer. This ulcer, due to low perfusion, don't respond to treat rather than normal tissue. Also, we have pressure ulcer. Pressure ulcer occur in immobilized patient. Some patient, for example, in ICU, some patient with coma, without any movement, have ulcer in the lower limb, in the buttock, and this ulcer very, very resistant to treatment because there is local ischemia in this area. This is also diabetic foot. After the trauma, diabetic foot became gangrenous, and if treated, we have many amputation in the foot because in this situation we have abnormal innervation, damage to a small nerve, damage to a small vessel. We have ischemia, abnormal innervation, and we have epithelial ulceration, and also damage to subepithelial and dermis tissue. This figure shows diabetic ulcer. In diabetic ulcer, we have a skin surrounding the ulcer and defect in the healing. In the defect, we have granulation tissue. mainly proliferation of small blood vessel, edema, and accumulation of inflammatory cells. Is susceptible override by infectious agent. But in some situation, we have excess production of scar formation. Excessive scar is pathology. In some patient and in some race, we have excessive production of scar. We have hypertrophic scar. Hypertrophic scar occasionally develop after thermal burn, occasionally after extensive traumatic injury. For example, after an injury, the skin is healing with many pigmented scar. We have excess production of collagen tissue, and it is common in some African people. It's called colloid formation. We have the position of collagen in the tissue, and this collagen is excess rather than the normal healing. Also, in some patient or in some injury, we have exuberant granulation tissue. For example, after burning, exaggerated granulation tissue formation inhibit normal healing. A small amount of granulation tissue is necessary help to healing, but when we have excess amount of granulation tissue, healing is not occurring. And in this situation, the surgeon remove exaggerated granulation tissue for better healing. In the wound, also we have wound contraction for nearing of age of ulcer together. But in some situation, this contraction is very high and causes deformity in the tissue and need to treatment. And also, we have almost fibrosis in parenchymal organ. For example, we have after inflammation in the lung, after inflammation in the liver, and also in other organs, we have formation of TGF-beta. This cytokine is responsible for scar formation in lung, in kidney, and myofibroblasts in some situation produce many collagen formation, and we have necrosis. Liver fibrosis, cirrhosis, and lung fibrosis associated with severe disease and replaced to transplant of liver, transplant of kidney. And this situation also TGF-beta is responsible. The last slide. In this figure, we review regeneration rather than scar formation. When we have marked defect, we have regeneration. Only epithelial cell damaged, regenerated. If we have normal SM cell, normal extracellular matrix. But when we have repeated or severe injury and damage is severe, we have granulation tissue formation, we have many macrophage inside with production of many interleukin, TGF-beta, and healing occurred by fibrosis. In healing associated with fibrosis and scar formation. In this situation, fibroblasts differentiated to myofibroblasts. Myofibroblasts have contracting ability and contraction in the ulcer is occurring. If you have any question, I respond to you.
Thank you.